Dave is someone who I served with during my career in the Defence Force. Dave epitomised what it was to be a professional soldier. However, every year at his annual medical assessment, he'd have the same argument with the medical staff, as they would classify him as obese based on his body mass index. He would argue that he could do his job, pass his biannual physical fitness assessment levels, and that his blood pressure, cholesterol, and blood sugars were all within a healthy range. Back then, if soldiers were obese, they were given the opportunity to achieve and maintain a healthy weight range or be placed on an administrative warning. Even after Dave actively participated in a weight management program, he was still classified as obese. I'm sure you know someone like Dave, who is overweight or obese, but physically active and healthy. During the last 15 years, there's been a meaningful discussion about the importance of fatness versus fitness in health. What we know is individuals who are overweight or obese but physically active, like Dave, have a protective effect against some heart disease and metabolic conditions such as type 2 diabetes. The term coined to describe this paradox is fat and fit. However, this term has the potential to be misleading depending on the individual's points of reference, and that only 1 in 5 people achieve the recommended level of physical activity for the maintenance of good health. We know physical activity levels for males tend to drop off in the middle age, that a combination of body measures is a better predictor of health-related fitness than a single measure, and that any increase in body weight affects all objective measures of physical fitness. We also know us males tend to overestimate our fitness and underestimate our weight. Using a mixed method research design, my research will determine how many active, overweight and obese 18 to 45-year-old males like Dave, when objectively measured, are truly fat and fit. I will do this by comparing perception against reality. Perception of their physical fitness levels will be measured by the validated International Physical Activity Questionnaire, whilst the reality will be quantified by objectively measuring the internationally agreed 5 components of health-related fitness. This research is important as it will not only build on the previous research describing the obesity paradox by filling a gap in the data for this hard-to-research target audience by measuring all 5 components of health-related fitness, but it will also confirm or deny the perception, even among healthcare professionals, of how can you be fit when you're overweight or obese.